Hello, I'm Dr. Nidhi Jain. I'm an obstetrician and a gynecologist. Today we'll be talking about infertility. Fertile period means from the 8th to the 18th day of the cycle in a normal 28 to 30 day cycle. That time of maximum fertility where ovulation occurs, and that is the time when you have the maximum chance of getting pregnant. The couple should try for at least 6 months to 1 year, and they should stay together for the same before consulting a doctor. But it is always good to have a preconceptional counseling. That is, before you start planning, you can visit a doctor and just get some general tests done so that you don't waste time in that later on. Infertility is the inability to conceive after 1 year of unprotected intercourse. The incidence of infertility is around 6 to 10% in India in the women. The causes of infertility in men and in the women are different. In the men, there can be ejaculatory problems, there can be problems with the sperm quality which can happen because of the sugar or diabetes. Then there can be problem of retrograde ejaculation, there can be history of varicocele, or there can be undescended testis which needs to be examined. In the ladies, the problems have to be divided into structural and hormonal problems. Among the structural problems, we need to check the uterus, the fallopian tubes and the ovaries. And then we need to do a lot of hormonal profile for the patient. So there can be PCOD, there can be diabetes again in the ladies, there can be problems with autoimmune disorders which can again lead to infertility. Infertility nowadays is on a rise because of our lifestyle, because of the eating habits which we follow, and a lot of adulteration in the food. Prevention of infertility can be started first of all at home with preventing a sedentary lifestyle and starting an active lifestyle, and eating fresh fruits and vegetables. We must avoid all the packed food with preservatives and all the refined foods, and it is always good to take good Indian healthy home food. Infertility can be diagnosed based on a lot of tests. So first of all, we go ahead with the hormonal tests. Secondly, we do an ultrasound. We also do an X-ray which is called the hysterosalpingography to assess the tubes, and of course a clinical examination is a must. Infertility improvement depends on your hormonal levels. It depends on the blood tests which we order, and we have some medicines which can improve the sperm quality in the men and which can improve the egg count and the egg quality in the women. Starting with the women, we need to see the hormonal levels and we give medicines, and we also need to check the blood sugar. We need to do a physical examination, and step by step every problem is taken into account. We do a follicle monitoring in which we see how the egg is forming in the ovaries, and that is done maybe daily or one day after another. And then we have an idea about the quality of the eggs and about the ovarian function. And from there, we can guide you about the maximum fertile period and how to go about. In the men, we basically do a semen analysis and then we give them medicines as and when required.